So the ODESSEY study is a prospective observational study, so meaning that we accrue patients who are untreated with metastatic renal cell carcinoma, but we don't control in any way what they get as far as systemic therapy or no systemic therapy, or what the specifics of those management strategies are. And so ODESSEY really is 13 institutions across the US, across different networks within PCORNet. And PCORNet is a initiative of PCORI, the Patient-Centered Outcome Research Institute, that basically we're taking advantage of the fact that they have a common data model. So while the patients are accrued at sites and there's certain baseline data entered, their data is then followed longitudinally, centrally via PCORNet, and also through the Duke Clinical Research Institute, where they're administering patient-reported outcomes questionnaires by phone every 3 months at first for the first 2 years, and then every 6 months thereafter. So what we're trying to get at is the patient journey, and that's why it's called ODESSEY. So the primary endpoint is actually around patient-reported outcomes, specifically using the instruments of the FIXI-19 and the FACT-G. And so we're looking, as opposed to clinical trials that look kind of, one therapy over one line, we're looking to follow the patient's journey potentially over multiple lines, but with the same instruments and the same timing. And so that's the idea behind it, and we're specifically interested in how real-world patients feel and function over time with these new regimens. We have two analyses. So one is on active surveillance, one is on systemic therapy. And so we're looking at the first 392 of 500 patients. And then so of those 392 patients, about 93 had no systemic therapy, at least initially on accrual, and the other 299 had systemic therapy. So the systemic therapy is a different abstract. So my abstract is on those 93 patients and really drilling down on the 53 patients who were classified as active surveillance. And how we determine that, again, we weren't controlling that in any way, we weren't randomizing. We simply asked the physician, did you select systemic therapy, yes or no? If they did not select systemic therapy, we said, well, why are you doing what you're doing? And so these patients were the ones where the physician said they're either doing active surveillance with disease present and stable, or no evidence of disease. And so we're focusing on those 53 patients. And so this analysis focuses on the median baseline quality of life findings, again, using FIXI-19 and FACT-G. And so we had a couple of interesting findings. So number one is that, as you might expect in ODESSEY, the patients who underwent active surveillance had a better quality of life, whether you looked at FACT-G or FIXI-19 or the subscale of the FIXI disease-related symptoms. So that's not necessarily novel, that's what we expected to find. But I think the interesting finding is when we compared those same median baseline quality of life numbers to the patients who are on pivotal trials, our active surveillance population was actually very similar to those in the 4 pivotal clinical trials. Whether you looked at Checkmate 214, Keynote, etc. And so what that suggests to us is that perhaps there were some patients that were enrolled on those clinical trials of systemic therapies that could have benefited from active surveillance, and that's what we're interested in learning more about.